coming to you from Nabakazi here in the Eastern Cape, outside of the town of Butterworth, where the Eastern Cape Health Department, together with aid organization Doctors Without Borders, are here to launch a 5-year partnership in an effort to address the issue of non-communicable diseases, particularly in rural communities. This is the pilot project, which is aimed at expanding in other communities, particularly here in the east side of the Eastern Cape. Let's bring in Cameron McCravey from the organization Doctors Without Borders. Ma'am, you're signing this 5-year agreement as a pilot project. What exactly are you hoping to achieve?
Thank you very much. The project is looking at investigating non-communicable diseases in rural areas and finding, in partnership with the NDOH and the communities, answers to how we can address this, how we can look at the lifestyle challenges, the access to food and access to medicine challenges that are especially prevalent in the rural communities here in the Eastern Cape.
What do statistics show about non-communicable diseases here in the Eastern Cape?
So non-communicable diseases worldwide are on the rise. This morning there was an article in the news that said 60% of diabetes in Africa, it goes undiagnosed. So as you can see, this problem is very prevalent and it is growing. And knowledge, especially in the rural areas, is very limited, and a lot of work needs to be done with the communities to see if we can find answers to addressing this.
In terms of capacity and the work that you're planning to do, take us through that.
Yeah. It's a very interesting project. We are looking at rolling out mentorship with the nurses who are working in the clinics to help them develop ways and programs to screen and treat non-communicable diseases within their primary healthcare settings. We are also looking at health promotion activities all around the communities and the villages which we are working in. We are looking at expanding external pickup points within the communities, especially by calling in community leaders, chiefs, to help start pickup points. There's a variety of different initiatives that we are going to be piloting, seeing how they work, and they're really adapting them based on the community needs and the community feedback.
The Eastern Cape Department of Health, where is it caught wanting that urged you to come and do this project here in the Eastern Cape?
So the Department of Health here in the Eastern Cape has been exceptionally welcoming and exceptionally open to investigating this. They understand that the rural communities have access problems, and so they have been exceptionally engaged with the problem, exceptionally willing to investigate ways in which we together as partners can move forward on this. It's not an easy problem to address, NCDs. It hasn't received as much airtime as tuberculosis or HIV in the past, and so we are starting a journey essentially together to work towards a solution.
Another challenge that one could say is affecting NCDs is patients defaulting on their treatment. How will you be encouraging that?
Yeah, I think especially in rural areas such as the areas we're working with, access to medicine is a real problem. So the South African government has created a system called the CCMDD system with external pickup points, which allows people in rural communities to set up external pickup points closer to their homes. However, there are some barriers to access, and that's where MSF, Doctors Without Borders, and the NDOH are coming in to assist, establishing more rural pickup points closer to the communities so that they can access their medicine easier, which could address the defaulting rate.
Thanks a lot for your time. Well, as they say, your health is your best wealth. So this project is aimed at addressing particularly that. As we are here now, the event is about to get underway, and it will be followed by celebrations. And these people who are expected to be part of this project are expected to get their work underway.